the long record of the work. Complaint of the cough, thoracic pain, dyspnea, and cough is mild, usually dry, occurs mostly in the morning. The pain is localized in the interscapular region and aggregate during the deep intake of the breath. Dyspnea occurs during the physical exertion. Vesicular respiration in the lungs is weakened, and the heart sounds are rhythmic, and blood pressure is here also supposed to be with mild hypertension, and abdomen is soft, and x-ray shows the micro nodular pulmonary fibrosis, so to make the diagnosis. So in the given condition is where the lungs is affected. In the given option from the previous question, you can correlate when iron is involved, so it is sideroblastic, so it is explained, it is not the cognitive option. Beryllium is a non-synthetic, so for the you can remember for the questions when workers work in non-synthetic fibers, so it is like cotton, mill, etc. So someone like some worker who work in the non-synthetic environment, so they suffer from this particular type of problem. Now next one, carboconiosis itself, it is explained that it involves the carbon and it has the carbon in the question, so this is going to be the answer. And the next one is here metal pneumoconiosis and the bicinosis. Okay, sorry, actually just one thing is mistaken, it is for the beryllium, and bicinosis is for the cotton industries. So like here you can see very clearly visible that in x-ray there is a pulmonary fibrosis, and in the patient is having some pneumonial symptoms. But why you cannot give the metal, either pneumoconiosis, if it was not given the metal, so this answer was going to be supposed to be the correct one, only carbonic pneumoconiosis, but metal is given, that is why it is not an option. Now if you for the betterment further, if you want to just second, if this option in the question it has been given, that it will be followed by the pneumoconiosis. It has two parts, one is metal induced and second one is carbon induced. Carbon induced is carboconiosis, so the two terms may be correlate in the further questions. So just keep in mind that the conceptually, like carboconiosis is a generalized term, but more correctly it is a pneumoconiosis. But because pneumoconiosis has the two divisions, metal and carbons, metal one involve like iron, it involve arginine, this kind of examples, like this aluminum. So these are the examples of the metal one, but given the given condition of carbon, that is why carboconiosis is the answer.